I have here Margaret Flowers, who is one of the Baucus 13. We watched you, Dr. Flowers, and all of the PNHP folks, hauled away. And the first thing I want to say is on behalf of the many single-payer supporters that I know are going to see this, we thank you from the bottom of our hearts for your willingness to go to any lengths for this. We really thank you. So a couple of things. First of all, I just heard this morning that Dennis Kucinich has called for a hearing next week, Wednesday and Thursday. This is in regards, it's an oversight hearing or a hearing? Can you tell us about this?
Well, he sits on the committee, Governmental Oversight Committee, and so, we don't get a lot of details until things are actually put together, but I did know that he was talking about putting together a hearing to bring in some of the insurance company administrators and try to get some real answers about their practices.
And what would come out of that hearing, ideally? I mean, what's the objective of that?
That's a great question. And since I don't have a lot of the details, I can't speak with any authority. But as you know, the private health insurance industry many of them are investor-owned facilities that finance healthcare to create profits for themselves. Don't make their decisions based on what's best for the health of the patients. They have practices that restrict care, that deny care, and at the same time, they, glean these great profits and pay high salaries to their administrators. And so we in the single-payer movement for a while have been hoping to bring them into Congress to kind of highlight and document and expose these practices so that people can really understand, what's going on out there, what they do, much like the report that was just issued by the California nurses, looking here in California at, how many claims are denied from the private insurers here. That information needs to get out. People need to understand.
Now, moving on to HR 676, which you talked about this morning here at the Senior Action Network meeting. Why is that not getting scored by the CBO? What is the reason for that?
Well, actually, now that we have the Wiener Amendment, we are going to get scoring of the bill that Representative Wiener is going to be promoting, putting forth in his substitution amendment on the floor. As far as CBO scoring of HR 676, there were scores done by the CBO back in the early 90s of single payer, not specifically HR 676 because it didn't exist then, but of looking at options that were very similar to HR 676 that showed that it would save our country money. So once HR 676 was introduced, we've said that we would like to get it scored again now that we have this actual bill. That's a difficult process because the CBO receives lots of requests for scoring, and so a lot of times they will only score the bills that are actively being, put forth in the committees or put forth on the floor. But now that single payer is on the floor of the House, we are going to get a score.
Okay. So on that note, now one thing, we saw actually some footage recently. I think it was somebody from Healthcare Now asked, I think maybe Rahm Emanuel and maybe a couple of other people that they grabbed in the hallway, why 676 was not on the floor. And I don't remember who it was.
I think it was Single Payer Action that did that.
Single Payer Action, sounds right. And whoever it was that they were talking to said, because we don't have the votes, because we don't have the votes. Okay, so first what I want to know is, how do we know that?
Right, great question. I mean, has anybody actually done a whip list to look and see how many people would vote for a single payer? It's an excuse. It's a very poor excuse in my opinion because what is the role of leadership? If a legislation is very important, the role of leadership is to push for that legislation, to educate for that legislation, and to get the votes. I mean, in the past that hasn't been a barrier when they wanted to get things through Congress. It's just an excuse, and so there's really nothing preventing them from voting yes on single payer. It's a great thing that single payer is coming to the floor of the House now because actually we'll be able to see who supports it and who doesn't, and that'll be very clear. And that will dictate our strategy moving forward, now that we have it,
Right.
straight out.
Right. How is that going to be enforced? How do we know it is going to be heard on the floor? I mean, what is in place that would stop that from happening? Is there some sort of law or rule that assures us that, or is this just Pelosi's word? I mean, how do we know that's really going to happen?
Well, it's on the record in the Energy and Commerce Committee that, because Congressman Weiner actually repeated it before he said yes to it, he said to Chairman Waxman, so you are telling me that if I withdraw this amendment, I will have a debate and a vote on the floor of the House this fall? And he said yes. So it is on the record. It's all the indications point to the fact that it's going to happen. The fact that Pelosi has agreed to let Congressman Weiner have it scored. The fact that his office is putting together the proposal that they're going to offer on the floor, it does look like all of that is moving forward. And a lot of members of the grassroots space have been contacting Representative Weiner's office and just, thanking him and kind of letting him know that we're out there and we're watching and we're expecting this to happen.
Okay. And a couple of other things we had questions about. Moving to the Kucinich Amendment, which permits the states to enact single payer if they wish to.
It helps them, right.
Right,
It gives them the
right, because it's a waiver to the ERISA restriction.
Right.
Okay, so on that one, what do we need to do as single payer supporters to make sure that we get that through?
Well, again, that's something that we need to make sure that it stays in the legislation that they're writing up. So that was an amendment that passed in one of the committees, Education and Labor, but there were 3 committees in the House putting the House bill together. And so we need to make sure that we let all the representatives know that we'd like that to stay in the final legislation as it gets reconciled. And then again, if something passes in the House and something passes in the Senate, they're going to have to reconcile those 2 bills. So we want to make sure that it stays into the final legislation as well. So contact, write letters, email, phone call. There's only one way that we're going to get to single payer, whether it happens this year or next year or the year after, and that's if we believe that it's going to happen and we work like it's going to happen. If we give up, it isn't going to happen. So even if we have a public option, which it's not very likely that we're going to have one, or a very strong one for that matter, it's not going to address these problems. We're going to have to keep pushing to get to the ultimate solution, which is a national health system that's publicly financed. I believe that the public option debate has been introduced as a distraction to make our community have these fights. So we're fighting over public option versus single payer, and we should really be putting that energy towards a real solution. If you look at the evidence, we've tried these types of programs with a public-private partnership in the past, and they have not succeeded once. Or if they did, it was like for a year or 2, and then they failed. So we don't see that as a viable solution, as a sustainable solution, and so we're going to keep, and I know I'm going to be out there fighting for as long as it takes to get to where we need to be.
Thanks so much, Dr.
Sure.
Flowers. We so appreciate your work, and I just learned that you are on Twitter now,
Yes.
which is fantastic. And tell us your Twitter account name
It's
again.
all capital letters, and it's MD for Maryland, PNHP.
Okay.
And I'm still learning the whole Twitter
Okay.
thing. I hope to be using it more.
All right. Terrific. Thank you so much.
Thank you.